Mini-series Biology of Sense Video 5. Today I'm bringing you a pedagogical expansion on the holistic and integrative practices seen in Video 4, what they are, what they aren't, and when they can be clinical, with a key phrase: just because something feels good or generates well-being doesn't mean it's therapy. A cup of hot chocolate is comforting, but it's not therapy. Energy and symbolic practices. Not clinical, holistic, spiritual, or experiential. Reiki. A system of laying on of hands without diagnosis. It doesn't evaluate anatomy, physiology, or pathophysiology. It doesn't define an indication or clinical follow-up. Pharaoh classification, spiritual and supportive practice. Not clinical. Not integrative healthcare. Use of crystals. Based on symbolic or vibrational attributions. Without a diagnostic framework or clinical evidence. Pharaoh. Symbolic ritual. Not therapy. Not clinical. Pendulum and dowsing. Symbolic instruments. They don't measure physiological or clinical variables. Pharaoh. Personal or ritual use. Not diagnosis. No clinical intervention. Muscle testing, applied energetic kinesiology. Critical point. Do not confuse with clinical kinesiology, rehabilitation. Pharaoh. Subjective symbolic tool. Not valid as a clinical assessment. High risk of suggestion and false diagnosis. Moon baths to recharge energy. There is no clinical physiological or energetic evidence. Possible effect: psychological, ritual, poetic. Pharaoh respectfully states, subjective ritual. May generate meaning or calm. Does not recharge biological energy. Not a therapeutic intervention. Body and natural practices, some clinical, others not, depending on the framework. Massage therapy. Can be clinical if there is training, indications, contraindications, and a therapeutic objective. Pharaoh. Clinical when indicated. Integrative bodywork. Not free, holistic. Phytotherapy. Plant versus harmless. Interactions, dosage, and toxicity exist. Pharaoh. Integrative clinical practice if there is training. Prior diagnosis. Indiscriminate naturalistic use. Mud, sea baths, sunbathing. Actual physiological effects: skin, circulation, vitamin D, circadian regulation. Pharaoh. Complementary hygienic and therapeutic measures. They never replace treatment. They are not therapy in themselves. Practices mistakenly considered therapy but not. Laughter therapy. Laughter is good, but it's not therapy. There is no diagnosis. There is no clinical process. Pharaoh. Recreational resource. Not clinical. Not therapeutic. Chromotherapy. There is no solid clinical physiological correlate. Aesthetic or symbolic use. Pharaoh. Sensory stimulus. Not therapy. Not clinical. Tarot. Surgical clarification. Types of tarot use. Divinatory tarot. Predictive. Not clinical. Excluded from the healthcare field. Symbolic psychological tarot. Carl Jung. Jung worked with archetypes, symbolic images. No predictive function. Pharaoh. Symbolic tool. Can only be used by professionals trained in Jungian analytical and symbolic psychology. Never as a diagnosis. Never as a direct therapeutic indication. Does not belong to integrative medical health. It can be used as an exploratory symbolic device in very specific contexts. Therapeutic writing, when it is clinical. Psychiatry and psychology. Jung. Active imagination. Symbolic writing. Working through the unconscious. Clinical if there is a framework, objective, and containment. Wilbur. Does not develop technical therapeutic writing. Contributes. Levels of consciousness. Self-narrative. Integration of meaning. Pharaoh. Uses writing as an integrative tool, not as an isolated technique. Nursing and therapeutic writing. Writing as elaboration of the experience of illness. Narrative record of suffering. Humanization of care. Pharaoh uses and promotes it. Pharaoh expands the nursing role. It provides an ethical and clinical framework. It does not improvise. Nurses have psychology in their interdisciplinary training. Pharaoh reinforces this with Jung and Wilbur. Art therapy. It can only be clinical if there is specific training. A therapeutic objective. Integration into a care plan. Pharaoh. Clinical when it is framed. Not painting because it relaxes. Pharaoh synthesis. Holism. Well-being, spirituality, experience. Integrative health. Clinical practice, diagnosis, responsibility. Pseudopathy. When the fields are confused. Pharaoh final statement. Well-being does not equate to therapy. Sensation does not equate to diagnosis. And ethics begins with knowing how to distinguish. Subscribe to the channel, like this video, leave a comment if you'd like, and share it to raise awareness. Learn science with a conscience. Follow the biology of meaning training to learn more with ECEL Pharaoh.